Ohio has instituted a new public health advisory alert system to help keep track of how coronavirus is spreading in specific communities. But how exactly does it work? First, there are 4 levels: yellow, orange, red, and purple, with purple being the worst, though it is a lovely color. There's also a list of 7 indicators that are used like strikes to determine what level a county is in. Yellow counties have 0 to 1 strikes, meaning people should just keep up with the current social distancing guidelines, and this is the lowest level in Ohio, so hooray! Great job! Orange counties have 2 to 3 strikes, indicating an increased level of exposure and spread in the community. This just means people should be using a higher degree of caution and limiting in-person interactions. Red counties have, you guessed it, 4 to 5 strikes, meaning you should try to limit yourself to necessary travel only and consider online options. I mean, come on. How much fun is it putting things in that tiny cart? Am I right? And a county goes to code purple when it has 6 to 7 strikes. And okay, those are the 4 levels. Pretty straightforward, right? But what are those strikes leaders are looking out for? First, they look at new cases per capita. When the data shows that a county has an average of 50 cases per 100,000 people in a 2-week period, that will be 1 strike. In this case, population size does matter. Then, they look at sustained increase in new cases. If the number of new cases continually increases for 5 days, that's another strike. Behind door number 3 is actually an interesting data point. Leaders are looking at the percent of cases that are found in non-congregate settings. We know the virus spreads easily in places like nursing homes, but those cases aren't that likely to go beyond those walls and into the general population, which is important to keep in mind when looking at community spread. So when 50% of new cases in a 3-week period are from outside congregate care facilities, that will be another strike. Next is a sustained increase in trips to the ER. This looks at the number of people who go into the ER with COVID-19 symptoms or with a confirmed case of the virus. If there is an increase in these visits over a 5-day period, that county will get, another strike. But it's not just the ER. They're looking at sustained increases in outpatient visits and in hospitalizations. And if those increase over a 5-day period, that's 2 more strikes. And finally, ICU bed occupancy. And rather than looking at county data, this looks at regional data of coronavirus and non-coronavirus use of ICU beds. This really just gives us an idea of how full our hospitals already are. So if regional occupancy goes above 80% on 3 days of a 7-day period, that, my friend, is a strike. So what does that mean for us? Well, really, it's just a quick way to get a look into what the situation is in our own backyard, so we can make the best decisions for ourselves moving forward. Plus, it could give us a bit of insight into what decisions local leaders could be making in the near future. For more information on coronavirus in Ohio, just head over to WTOL.com/coronavirus.